So hopefully you all will have selected your language preference at this point. The only languages we have available today are English and Spanish. We will put further directions into the chat as folks arrive. So team, please do add the instructions in English and Spanish into the chat so folks are able to access their information and choices for language preferences as they join. And without further ado, I'd like to get us started. I'm super excited to have Dr. David Hayes-Bautista with us today. He is a longtime friend and colleague whom I have a tremendous amount of respect and admiration for. Really, really excited about him joining us today. As you can imagine, he has been quite busy since the onset of the pandemic, but in his true fashion, he has been spending countless hours keeping all of us informed and educated about the realities of this pandemic and I want to say, a lot of truth telling, right? This is a moment where many myths and a lot of misinformation are thrown around, especially as it relates to our communities of color. And particularly here in Southern California, where we have a tremendous, community of hardworking Latinx families who represent the majority of our population at this point in the Los Angeles region. It is of extreme concern how this pandemic has impacted our Latinx families. And so Dr. David Hayes-Bautista has been kind enough to join us today and is going to share what he has been learning over the course of the last year and how we can use that information to further support our Latinx community members and family members. And more importantly, myth busting. The level of misinformation, I can't underscore that at all as it relates to, how the story gets told, how each of our communities are managing the pandemic, how we are impacted by it, or even worse, as we're seeing with a lot of the anti-Asian hate, how somehow different communities of color are responsible, for the pandemic in some way, shape, or form. So we are looking forward to having further conversations like this. We'll be doing another conversation with Dr. Vargas from Charles Drew University, where we focus on the impact of the COVID pandemic on Black communities. And we will also be following up with another conversation around the Asian and API community and the pandemic as well. So please do stay tuned for those future conversations. But without further ado, I'd love to turn this over to Dr. David Hayes-Bautista, who will take us through a brief presentation. Then we're going to have some Q&A because I have some questions I've been dying to ask him. And then the last part of this session, we will look to your questions. So please do feel free during the course of our conversation today to put your questions, be they in English or Spanish, into the chat. And we will do our best to get to as many of those questions as possible once we get to the open question and answer session. So with that, Dr. Hayes-Bautista.
All right, thank you so much, Michelle. I need to share screen here. And while I am sharing screen, in terms of interpretation, I'm a Chicano. So I speak neither English nor Spanish. I speak Pocho, but I couldn't see a button for Pocho. And people say, well, why do you want to speak Pocho? Why don't you speak Spanish or English? I say, well, I speak Pocho, pero hablo un Pocho perfecto. Okay, rim shot. I want to share some of our work on COVID-19, particularly in terms of diversity. It's been clear since the beginning of this pandemic, all the way back last April. In fact, if you notice the date on this, almost a year ago, even in the very early days, it was clear that populations of color were suffering higher rates of infection and even higher rates of mortality than non-Hispanic white. So in a report that we released last, I believe, September, reporting on data for July, here we have the age-specific death rates per 100,000 for the age group 50 to 64. Now, these are people in your prime working years. They're at their peak earning power. And what we noticed is even back then, the non-Hispanic white death rate was 5.9 deaths per 100,000. Asian was about 30% higher. American Indian was about 3 times higher, as was Native Hawaiian, as was Black, and Latino was about 5 times higher. And we have just seen these relative proportions continue as, of course, more and more people got infected, more and more people died. But it seems as if people of color, populations of color, have consistently been more affected by positivity rates, infection rates, hospitalization rates, and ultimately death rates. So the question is, particularly for Latinos, I mean, you notice how I was way out there. Why do Latinos have a higher COVID-19 death rate? Well, I'm a scientist. I'm a researcher. I live in a world of science. I was raised in science. I was raised as an engineer. I do data. But I am aware of how science is done. So this quote, which actually is from a New York Times Magazine article, for me summarizes the best way I've ever seen put what happens in science. Facts, and of course we all know about facts, and I deal in a world of facts and data. Facts tell different stories depending on who is picking them and placing them in a narrative line. Gee, aren't facts facts? Well, yes, but it depends which facts you choose to look at. And of course, in any given piece of research, any given study, you can't look at every fact in the world, so that the person who is picking the facts and then placing them in a narrative line is very important. So there is one narrative line I've been hearing ever since the beginning of this pandemic. Actually, I've been hearing it all my life, is the narrative of Latino dysfunction, that Latinos just can't do anything right. Along came COVID, and some of the early clinical studies out of China and Italy, and then later on Spain, they noted that once people were in the hospital and once they were on respirators, once they were in intensive care, those who had comorbidities tended to have higher death rates than the ones who did not. There are a number of comorbidities, high blood pressure, et cetera, but people seem to pick on obesity and type 2 diabetes, although those are not the only comorbidities. Well, what do most people think they know about Latino health? Well, we know that Latinos are obese. Well, that's true, Latinos are obese, but so is everybody in this country, way far more overweight and obese than we ought to be. It's not a uniquely Latino condition. And we know that Latinos have higher diabetes, both prevalence and death rates than white. Well, that's true, but so do, in fact, almost all other populations of color. So it's not a uniquely Latino thing. Oh, but then there are cultural inhibitions. Latinos have the wrong culture. We don't like to respect laws. We don't like to be told what to do. We don't like to wear masks, blah, blah, blah. This was under the previous Trump administration. His Secretary of Health basically saying that minorities have health problems because they do the bad things. And then, of course, in comes the immigrant issue. And according to the Trump administration, Latinos were bringing COVID across the border and infecting the US population. So these are the narrative of Latino dysfunction, with cherry-picked facts used to illustrate that narrative. And that's generally the one that most people hold in their mind when they talk about Latinos than anything: education, COVID, you name it. However, I am a researcher and I use the scientific process, but I developed my own research voice a long time ago, back during the Chicano days, the days of the Chicano health movement. And as a researcher, I look at the data and I look at the facts, and I can tell a different story because I am the one picking them and placing them in a narrative line. And this narrative line is buttressed by decades of research and publications. So what I saw at work was something different. It wasn't Latino bad culture and obesity and diabetes. For me, the major issue was that Latinos, like many populations of color, but particularly Latinos in this state, were the essential workers, but not very important. We didn't bother to worry about what happened with these essential workers. Early in the pandemic, you heard a lot about having to protect essential workers. I'm on the board of a hospital in East LA, and patient population is 95% Latino, so I'm aware of this. And immediately people thought of the physicians and nurses. We made sure they had the personal protective equipment. They got the training to learn how to don the equipment, how to doff it. They got negative pressure rooms. We did everything we could to protect those essential workers. But there were other essential workers that were off the radar scope because the ones making those decisions were not familiar with this population, such as the farm workers, the ones who grow the food that we all eat. Very essential. If you all remember the first couple of months of the lockdown back last March and April, when people in the grocery stores were fighting over rolls of paper towels and toilet paper. Well, I keep saying, well, if it weren't for farm workers, you would not have been fighting over toilet paper. You would have been fighting over the last sack of oranges in that store, and that would have been some very serious fighting. But we didn't bother to think about farm workers as essential workers, although the average human body does not do very well after about 48 hours without food. So they didn't get personal protective equipment. And of course, the working conditions, quite often farm workers or packing house workers have to work shoulder to shoulder, particularly in the processing plants. So we see here just as how a processing plant works. And those workers showed up, and the COVID has just ripped through those industries because it's hard to separate people out and get the work done. And yet they have continued to work, and we have had food on our table. We have fruits, veggies, meats, you name it. The grocery store workers. This one is, for me, is chilling. This is now a month into the pandemic, April 13th. I notice this cashier is not wearing a mask, and neither is the client, because they were not offered personal protective equipment. Again, they kept the store running. I thought they were pretty essential, but we didn't consider them as such. That cashier is going to have close to 200 people be within an arm's length of her, and nobody is using any personal protective equipment. And California is not unique. We saw this across the country. So quite often these essential workers had to supply their own personal protective equipment. And the transportation workers, the bus drivers, the metro drivers, etc., the ones who cleaned the offices, doctors' offices and hospitals. For me, this was kind of the most puzzling in many hospitals, even though we took great pains with the doctors and nurses. When the night shift came and people came to clean up, we didn't bother to give them usually PPE or instruction. The nursing home attendants, likewise, did not get the PPE very often. The other people that helped keep the state running, automobile mechanics, gardeners, construction workers, all these folks helped the state run. And of course, many of the farm workers now, those roles are filled by indigenous populations who speak various indigenous language, Mixteco, Zapoteco, Tzatzal, Tzotziltriqui, you name it. And we didn't bother to give them protection or even get information out in language. So here you have this whole group of essential workers who kept the state going, paid very, very little. This story by La Opinion, even just before the pandemic, pointed out that here in the Central Valley, there are Latinos working full-time, not even making minimum wage, even though they work very hard. And of course, I need not say very much about housing costs here in California, particularly Southern California. They're sky high. Latinos have had a workaround, which is you split the rent amongst more people. So the housing is more crowded. Trouble is, COVID loves crowded housing. It's much easier for COVID to spread itself. And of course, we tend to have the multi-generational households and Latino households. Then, of course, you have a workforce that not only continues to show up for work, was exposed to coronavirus, paid very little. We didn't give them the PPE. Quite often, they work in industries that do not offer health insurance. Just in general, Latinos are about twice as likely as other populations not to have health insurance. And then you look at specific occupations such as farm working. Rarely are farm workers offered health insurance by the growers that they're working for. And the low income and the lack of insurance then comes together in terms of paying out-of-pocket costs. Tests, which if you remember, everyone was encouraged to get early on. Well, they could have been covered and they could not have been covered. And it's sometimes been difficult for a client to know, if I get tested, am I going to get a $100 test cost? Or it can go up to over $2,000 per test. And it's been that way for over a year. Add to that the Latino physician shortage, which is huge, and it's getting worse every year. So if you remember about the first 4 months of the pandemic, you needed your doctor's permission to get a test. Well, if you don't have a doctor to go to give you that permission, or you can't go because you don't have insurance, or you don't go because you don't have the income to pay for out of pocket, you're not going to get tested. So we're not going to know that you're exposed. At least the state of California was good enough to offer some initial alerts in language, in Spanish. So this ad was, if you have any signs of emergency, debe comunicarse con su proveedor médico de inmediato. Well, for a lot of Latinos who are not so sufficient in English, is can I find a doctor I can talk with? I can't find a doctor who speaks Spanish. And by the way, this is nothing new. Medical services have been provided in California every single day for 252 years. So provision of services in Spanish is not a new request being made by some identity group. This is simply part of the history of California. And of course, immigration policies then run roughshod over all of this. ICE continued rounding up its undocumented workers, even though they were supporting us in terms of growing our food. Here's a sad case in Colorado where a gentleman was admitted to the hospital because he was coronavirus positive. They were going to put him into intensive care. ICE came in, picked him out. They're going to deport him. And of course, hello, he was infected. He's positive. And the Trump administration continued deporting immigrants, well knowing that many of them were coronavirus positive, so that we are essentially seeding coronavirus across Central America and Mexico because of our immigration policies. And that very first CARES Act that came out last July specifically excluded households that had non-citizen members, not undocumented, just simply not citizens. So they could be green card holders generally employed, but the whole household was excluded from all of that. So I would say, well, as I look at the infection rates and the hospitalization rates and the mortality rate, I would see something different, that Latinos are functioning. The social systems are dysfunctional. That is the problem. Let me wind up, by the way, just putting some dollars to this, because unfortunately in this country, human beings are not worth being humans unless they're worth $1. I would argue with that, but okay, I've been arguing with that for 50 years. We have been, for the past 4 years, calculating the Latino gross domestic product. That is, what's the total value of all the goods and services produced by the 60 million Latinos living in the United States. And we release this report every year. This was released last September, right in the middle of the pandemic. And so, to the surprise of many people, this total monetary value of everything that Latinos produced and finished was the equivalent of the world's 8th largest economy at $2.6 trillion, bigger than Italy, Brazil, South Korea, Russia, et cetera. Just a step behind India, France, UK. I mean, the Latinos have produced a big dog economy. And as we look at the growth rate of those top 10 economies, the Latino growth rate 2017-28 was just blazing hot at over 8%. The US total was about 2.5%. But remember, facts tell different stories depending upon who is picking them and placing them in a narrative line. Well, our end of year report, we pointed out, this is for California. This blue line is the total number of non-Hispanic white deaths, and here's the total number of Latino deaths. And of course, Latinos tend to be younger than non-Hispanic whites, so Latinos are far more likely to be in the working age population, creating that world's 8th largest GDP, and they're dying at a much higher rate. That means that the Latino GDP may be very seriously affected. So ultimately, when people ask me, well, what's the big picture? Why is this new situation of Latinos getting the raw end of the stick? And I keep saying it's nothing new. Actually, this has been going on for 170 years. The formal medical institutions of this state have turned their back on Latino health. COVID just simply illustrated this one more time, and in a way that could affect the supply chain of food items that we all need in the stores. The cost of inequality has too often been death. Thank you very much. And let me turn this back to you, Michelle. It's all yours.
Thank you. Thank you, Dr. Hayes-Bautista. I'm just, I'm just speechless. As much as I read the information and live and breathe in the work that we do around advancing social justice, I just remain so disheartened by the realities and the impact and the constant attack on our human rights. And as you mentioned, these are things that have been going on for centuries. They're not things that have just appeared as a result of the pandemic, but that the pandemic has clearly and continually put on display the lack of equality, the lack of access to fair and equitable resources to support our families. And with that in mind, what I had wanted to ask you about was the intersection that you brought up, right? Like in this time, we are really hearing a lot more, especially at the start of this pandemic, about things like universal basic income, you know, coming back to the conversations of universal healthcare, right? So these notions and ideas that there are certain rights around basic needs and necessities that it seems that Americans are possibly beginning to really warm up to, especially as this pandemic has really exposed how vulnerable we are to this type of a scenario when we don't have supports like basic income or access to universal health care. But as you mentioned, the real problem is our perception of what it takes to have a healthy economy, right? So I'm not pretending to be an economist. I know that you made it clear that you have a medical and engineering background, you're not an economist either. But for a minute, let's both play economist. And I want to ask you, Dr. Hayes-Bautista, given that tension between what I'll just call, you know, basic human rights in terms of, you know, having enough income to provide for your basic needs and having access to, you know, healthcare to, you know, maintain your health in competition with what people believe is a healthy economy. What is your response to that in this day and age?
Well, I'm often asked when I'm being interviewed by reporters, so what can we do about this? And I say, well, there's the short-term answers and then there are the long-term answers. So let's talk about the long-term answers, and simply this. As you look at those top 10 economies, of all those economies, the US is the only one that does not offer some form of universal access to health services. Japan, UK, Italy, Spain, they all do it. And it hasn't corrupted their economies. They haven't become communist states overnight. And these are political decisions. Right after World War II, all these other, particularly the advanced industrial countries, decided that this was a human right and it needed to be included along with education, clean water, clean air. These are simply things that human beings deserve for the fact of being on this planet. So whether it's by a national health service or national health insurance, et cetera, all these other economies provide that. We chose differently. We chose a different model, more market driven, more based on the Calvinist principle that if you work hard, you get what you deserve. And if you don't work, we need to make welfare so odious that you'll take any job at any price rather than have to live on the expenses del Estado. You have to live on welfare or something. So we have this very, very miserly social support system. And we see the result of that. Those who have worked the hardest, the one who are essential workers, have received the least support, the least protection, and not just in the past year. This has been going on for 170 years, but we can see now very clearly they have paid the price with their own lives, with their own bodies, for showing up for work every day. So it's not impossible to do. Every other country in the world, every other advanced industrial country has figured out how to do this. By the way, they spend a lot less in healthcare than we do, and they're far healthier. And here I have had to talk with people who have had to make decisions. Do I go in for a hospital because I'm not feeling well? I don't have insurance. It's going to cost hundreds of thousands of dollars. How do I pay for that? Maybe I should continue working, at least pay the rent. I mean, they have to make these decisions that in these other countries, people don't have to make the decisions. Do I buy my medications or do I buy food for the table? They don't make those decisions. We do. And they're very heart-wrenching decisions, particularly when you are an essential worker that's considered unimportant.
Thank you for that. I think this is a extremely critical conversation as it relates to the state of California. You know, oftentimes that saying, so goes California, so goes the nation, right? So as we're talking about putting in supports and considering, you know, universal access to healthcare as a state, you know, for all Californians, as well as the proposition of universal basic income, which is being piloted, as we know, up and down the state of California. Most recently in Compton, I know is launching another small pilot around universal basic income. These are the types of supports that need to be put into place so that our communities, especially as you pointed out, Dr. Hayes-Bautista, our communities of hardworking Latinx families aren't bearing the brunt as we opened up this convening today of the COVID pandemic and suffering the consequences. One of the articles you shared with us at the end, the byline under it that I was reading was that that their family lost both of their patriarchs, right? So both of the folks who were providing and caring and supporting that family have now disappeared. And that entire family is left without the resources that they need, further exacerbating our other problems, right? Lord only knows, homelessness, mental health support, all of the other traumas, you know, that come into play as a result of suffering as an essential worker and as a provider for your family during this time, when we know that something as simple as $1,000 a month might have helped to support people through that moment. And we've waited over a year now, right, to even get a little bit of that. And it's still not much, So one of the other questions, I'm gonna take a big turn here, is to ask you about your vaccination experience. As we're talking about, you know, folks kind of pinning onto our communities this idea of resistance to the vaccine, hesitation about the vaccine. I'd just love to have you share with us, Dr. Hayes-Bautista. Honestly, I'm going to say I haven't been vaccinated yet, which I know isn't a big deal. I haven't, you know, really qualified as part of the early waves. So I'm anticipating, you know, getting my shot in the near future, and certainly would love to have you share with us what your experience has been like, especially as a medical professional, so that other folks here can spread the good word of your positive vaccination experience and hopefully give us the ammunition we need to get our families on board. I know I, for one, am going to set an example in my family because folks are nervous about getting their vaccination.
Well, let me paint the bigger picture. I've become an historian in my older age, and I look particularly at the epidemiology of the conquest. By the way, we're commemorating the 500th anniversary of the fall of Tenochtitlan this August. Big day, we're going to do something for it. And of course, what made the quote unquote conquest possible, and I'm putting air quotes around conquest because they really didn't conquer all that much, but that's a whole nother story. Nonetheless, they did bring European pathogens such as smallpox, such as whooping cough, such as mumps. I mean, simple childhood diseases against which Europeans, even pre-vaccination, had developed a herd immunity to, and they just ripped through the indigenous populations all through North America, South America, Central America, and Mexico suffered a 95% death rate. The day that Tenochtitlan fell, the population of what's today the country of Mexico was 25.5 million. 75 years later, the population was 1 million. 24 million out of 25 died to achieve herd immunity. Okay, so actually as Latinos, we are the children of an epidemiology, a series of pandemics, went on for about 75 years. So with that in mind, I know people say, well, we'll just let nature take its course. Well, you want 95% of you want 14 million out of 15 million Latinos to die? Well, that's why vaccines are a solution. They're a part of a help. They are not perfect, but they are certainly far better than letting 95% of the population die. When I was a kid, I was part of the original polio vaccine trials here in Southern California, Los Angeles as a kid. I get a flu shot every year. And in fact, that's part of it. I have to get a flu. We all should get a flu shot every year because the flu strains mutate year after year after year after year. So part of what CDC tries to do is anticipate, well, next year we're probably going to get this variant, so let's prepare the vaccine for it. And of course, there's some people for whom the vaccine, most people, it works very, very well. You get some outliers for whom it doesn't work so well, but that doesn't mean we don't vaccinate, or just because the mutation got away from us or something. It helps to keep the death levels down. Not 100%, but far better than 95% death rate. So yes, I got vaccinated and I got a double whammy. I'm old and I'm fat, so I was at high risk. So I was one of the earlier, but stepped right up, as did my wife. Not a problem. And we get our flu shots every year. And I know there are anti-vaxxer movements out there, but I've seen what happens without the vaccination. It's part of our history. We need to understand it and read it. You don't want 95% of us to die just so that somebody can go around without a mask and without a shot.
Wonderful. Thank you. Thank you for that, Dr. Hayes-Bautista. And so now I want to take a look at our chat. I know that there are a couple of questions, so I want to do the best I can to address those. And please do put them into the chat. We're not going to be allowing folks to unmute themselves, as we have a lot of folks. And if we do that, it's going to get quite noisy because not everybody remembers to mute themselves. And so I'm going to read through the ones that I can see. It says, can you mention, Adriana Diaz says, can you mention that it is normal to have symptoms after getting a vaccine, like the flu, but that doesn't mean people are getting the flu from the vaccine. We get a lot of confusion about this in our community.
In medicine, almost any intervention has the possibility of some negative consequence, some negative after effect. Even with just regular flu vaccines, with regular shots, just with regular doctor visits. I got an artificial knee put in last year, and I'm having some after effects. That doesn't mean I wouldn't do it again. So we need to understand a little bit about distribution curves, cherry picking. There's almost any portion of human existence, I can cherry pick a case and say, well, because this thing, one person had this situation, we shouldn't do anything. But that's cherry picking. Again, facts tell different story depending upon who's putting them in a narrative line. My narrative line goes back 500 years, where 95% of indigenous in the Western Hemisphere died because of chickenpox, mumps, things that we think, nobody dies that anymore. They did then. So I take this stuff very, very seriously. So yes, there will be, and medicine is partial. It's not like medicine is perfect and everything works perfectly the first time, every time. There's judgment, there's an art. But just because there's an art to it doesn't mean we don't do it. So along with everything else, it's a matter of what are the odds ratios. If we do something, we know this will happen. If we don't do it, we know more that other thing will happen. I know, again, 500 years ago, 95% of us died. I don't want to go there again.
Excellent, thank you. And I'm just going to read from Gypsy Vasquez Ayala. She says she completely agrees with you, Dr. Hayes-Bautista, regarding the conquest. I am a traditional Aztec dancer and very connected to my culture and ceremony. It was difficult to decide to get the vaccine, but I did just recently, the Johnson & Johnson, and it went very well. I also had the rest of my family get vaccinated. Thank you for the work you do, and I would like to learn more about your work. So on that note, actually, Dr. Hayes-Bautista, can you tell folks a little bit about how they can follow you or, get more information that you're sharing, since I would say that Community Health Councils is validating you are a credible source. So we encourage people to follow you, to read your work and to keep up with your articles. And what's going to be the best way for them to do that?
Well, my center has a website. And one of my staffers, Adriana Valdez, is in on this meeting. So if she could send the website to you, Michelle, and you could send it out to everybody.
She can put it right in the chat. So
okay, Adriana, can you put it in the chat? Thank you. And by the way, speaking of vaccination and all of this, when people ask me, well, how do we get vaccines out if there's a physician shortage and a provider shortage? I say, great. But because the shortages 50 years ago, we put together our own alternative healthcare system, which was the community clinics. And actually just recently, we wrote a book about it, this called The Chicano Boom, Healing California, 1965 to 1985. It's a very lavishly illustrated book with a lot of art from the period about La Cultura Cura. And that was our motto, that our goal was not just to provide medical services. We wanted to have healthy individuals living with healthy, empowered families, living in healthy, empowered communities. That is why we set up the community clinics. They are there already. They have connection with the community. So if you want to get information out, and if you want to do vaccination or vaccination education, why not use the community clinics? But of course, the people making the decisions aren't familiar with that history. It never occurred to them, just like it never occurred to them that farm workers are as essential as physicians during this pandemic.
Thank you for that, Dr. Hayes-Bautista. I do know that that has been a challenge as of late. And so I'd love to talk about that for a moment. You brought up the issue of community clinics in relationship to vaccine distribution. What is happening with that right now in your perspective?
Oh, well, again, the 170 years of turning us back to Latino health is being played out one more time. And when we have a tremendous Latino physician shortage, and there are very few physicians' offices and lack of healthcare insurance and low income and all, put all these things together. And I get these calls all the time from the major health institutions of the states. So, and it's kind of, you guys have got to help us solve this problem. And my first response, well, wait, it's been around for 170 years. We didn't just create it. It's been here. You just have not seen it. You've chosen not to see it or to deal with it. But we do have an answer, which again, you have not seen, which are these community clinics and the community organizations. There's a lot of agency in the communities, the people of color in this state, a lot of agency, a lot of institutions. They've been there for centuries. Just mainstream California doesn't see them, doesn't recognize them, doesn't know about them. But doesn't mean they're not here. So it's a matter of utilizing the resources that we already have, using the strength, the knowledge, the wisdom that we already have. There's a lot that's very, very right in our communities.
Great. Okay, thank you. I think it is quite disheartening to know that our community clinics are not being properly used, to distribute this vaccine and to reach out to our communities around this. Certainly, I know many of us are working on advocating that community clinics play a bigger role in this effort. And so for those of you who are working in that space, the more that we speak up, the more hopefully progress we can make in that space. As of right now, I believe most folks are we're all accessing vaccination, resources either through the pharmacies in our areas or through some of these major vaccination locations. Like I know Cal State LA had a big vaccine set up and things like that. But I often tend to call those, as you were talking about, Dr. Hayes-Bautista, we're subject to these huge cattle calls, right? So as opposed to other communities are able to make, much more dignified, arrangements to get their shots or to even get their test. While unfortunately in our communities, we're relegated to, for lack of a better term, being treated like cattle, right? Herd us into large spaces and poke us with things, which again, does lend itself to some hesitancy on our part around receiving the vaccination. So coming back to some of our comments here that I'd like to read, Carlos Leon says, I have learned that it is mainly the inequitable access in our communities that has prevented our Latino communities to get their shot, as well as outsiders coming to communities of color to get the vaccine. And that language barriers on the ground, outreach, that we need more Spanish town halls where people can access the information. So is that something that you've heard much about, Dr. Hayes-Bautista, which is folks traveling into different communities in order to access resources?
Oh, yes. And not only on COVID-19, we've seen this in a whole host of other institutions, such as, for example, higher education, such as admissions to medical schools. So that, for example, when we look at the medical schools in California, it turns out that they rarely, whether they're public or private, and this includes UCLA, they rarely admit a graduate from the Cal State system. I went to the white coat ceremony last year, 2 years ago. We put on white coats, the first day of medical school. On 140 students, 6 were Cal State graduates. Hello. So you either have to be a UC graduate. I think we have more students from Ivy Leagues. I know we did far more from Ivy League schools than from Cal States. Now, wait a minute. We're the University of California. We're a public school. Why are all these other folks coming in? Well, duh. And this is a pretty good education that we can offer at a decent price. But hey, wait a minute. And so when this happened to COVID, I think, oh, there it goes again. Now, interestingly, of course, the white supremacists like to look at communities of color, say, oh, you guys are cutting in, you're cheating, you're doing affirmative action. Well, hey, wait a minute. 170 years of neglect. And when I say, well, how can we possibly admit more Latino medical students or medical students of color? And I get all these excuses. And so our communities continue to suffer and folks still come from the Ivy Leagues. And I'm thinking, well, that doesn't help the farm worker family out in Narvin, because I don't think the Ivy League folks necessarily are going to go out and set up their practice there. A few will, but they're going to be very, very few. And God love them when they do make that choice. Most will not. So this is nothing new. Not at all. Not in this state.
Thank you. And I think to that, Sonia Vasquez, who's a longtime supporter and advocate in the communities and one of our leaders here at Community Health Councils, thanks you for your presentation. And she says, we know that the best strategies for our communities is to have local solutions. Can you share how this is occurring, any best practices and ways that we can ensure that we can advocate for more vaccine sites in our communities and better access to the vaccine?
Okay, well, here we have to talk about interinstitutional communication. To begin with, we have our own alternative system that we created 50 years ago, the community clinics. I had the honor of being the founding director of La Clínica de la Raza over in the Fruitvale district of Oakland. And we very purposely chose to provide a different kind of care. Like I said, our goal is to have healthy, empowered individuals living in healthy, empowered families in healthy, empowered communities. And one of the ways of assuring that we were not just simply giving out bandages is that we purposely made our boards of directors so that over half had to be patients being served by La Clínica. And in fact, we wrote this into the regulations. When we started these community clinics, we were kind of like in a no person's land. We weren't a private physician provider, and we weren't a hospital. We were a community clinic. We didn't exist legally, so we had to write the regulations. And when we wrote the regulations for California, we insisted that the majority of the board members had to be patients served by the clinic. That was then taken at the federal level, is written into the federally qualified health centers law. So that helps to keep the clinics grounded in what are the needs of this community here. Now, that needs to be communicated now to the other institutions, the medical schools, the county health departments, and that's where the communication tends to break down. And again, we saw it in this pandemic. As soon as coronavirus was detected on the Pacific coast, we went into gear and immediately we were told, here's how we're going to stop this. Take your laptops, unplug them from work, go to home, put on a mask and do your work from home. Take your kids out of school and they can do their homework from school. Well, this assumes everybody has access to broadband. Every individual family has an individual screen. This assumes that you can pick strawberries from your front yard or from your front room, which of course you can't do. They just simply didn't realize so many people couldn't do that. That was not an option. And we didn't think about it. We dithered and dithered. And meanwhile, coronavirus swept through over and over and over again. And again, it has to do with these were essential workers. They were unimportant. They weren't clinical. So we didn't deal with them. They have paid the price. Once again, it's who is selecting the facts and who is placing them in an narrative line, which is why we need more minority researchers at the research lab. We really do. So I'm a researcher. I'm a big advocate, not only more diverse researchers with voice. To develop their voice, they can raise their hand and say, wait a minute. So how is this going to work for a grocery store clerk who can't check out groceries from her living room remotely? How are you going to protect this person? But You didn't have, I guess, those people at the decision-making table. So we created this wonderful prevention measure that really works well in the Platinum Triangle, Beverly Hills, Bel Air, Brentwood. Works really, really well. It's not going to work so well in Oxnard or in Arvin or Porterville. It's just not going to work, but didn't think of it.
Absolutely. Yeah, I think, we've also seen, of course, the whole issue, even when folks did get sick, the lack of ability for us to quarantine from one another, right? And you have big families and you're living together, and, you don't have the luxury as many folks do of having, 3 bedrooms and 3 bathrooms and and the ability to, be away from each other. Then that further exacerbates, this issue. And again, in the presentation you gave, very grateful for that. One of the bylines I was reading as you were presenting was just that reality of folks going to work as an essential worker or as a laborer, and then being horrified at the fact that they're supposed to go home to their families now.
Mm-hmm. Yeah.
And not being able to have the resources like other institutions, as you mentioned, do, to just, I'll just go stay at a hotel for 2 weeks to protect my family, which is clearly not an option that all of us have. And so with that, one of our last questions, I think we have time for a couple. Margaret Hernandez says, thank you for the great information, Dr. Hayes-Bautista. Do you have any suggestions for strategies Latinos can utilize to improve our situation in this state and this country?
Yes. And it's very simple. If you're eligible, register to vote. And next time there's an election, vote. And if for some reason you're not eligible, find a friend or relative who is, take that person by the hand to the registrar's office, register, and vote. And I know people say, just one vote, it doesn't count. Only 11,000 votes in Georgia made the difference between actually having a pandemic response pattern that just got passed, approved, and funded, an infrastructure plan, opening up Medi-Cal enrollment to a wider base. 11,000 votes in Georgia made all the difference between this happening that we're seeing, and it would never have happened. 11,000 votes out of nearly 140 million cast. Your vote is important. It's so important. There are people that don't want you to vote. They're taking every possible step they can to make sure that you don't vote and you don't vote and you don't. Just 3 votes out of this group that don't vote, and they won. Register, vote. Register, vote. We can change anything.
Thank you. Totally agree with that. So can't underscore it enough. But that comment does beg the question of something that we deal with on a regular basis at community health councils, and certainly myself. I'm born and raised in Los Angeles. I've spent, since I was 16, since 1992, LA riots, doing nothing but advocacy work. And clearly a large part of that has been advocating for undocumented communities and the enormous lack of resources, mistreatment, abuse, that our undocumented families experience. And with that in mind, you did mention, this in some of your presentation, Dr. Hayes-Bautista, around, not only just the incredible amount of exploitation that Latino family and workers experience, especially now at the pandemic, when they're some of the only people who are still keeping our economy going right now, especially here in Los Angeles County. With that in mind, what sort of advice do you have for us, especially in a community like South LA, where 48% of our Latinx population is undocumented, right? That's half of our families living in communities where I know myself, I struggle in being supportive and trying to offer options, where folks can feel safe in getting tested and getting vaccinated. So I would ask you, and I know that we have several folks who I dearly love and adore, who are from our Best Start communities, and their moms and their grandmoms, and they're really trying to exemplify and model, best practices to protect themselves and their families. But again, this issue of being undocumented is a really scary and very real situation. And yes, especially even if you are trying to do the right thing and getting tested and getting vaccinated, but you're scared and you don't want to put your family at additional risk. What advice do you have, for us, people like myself who are on the side of trying to support our undocumented communities in being safe and accessing services? And what advice do you have for our families who are also doing the same?
Here's where the power of narrative again is so important, because the narrative about undocumented, and from California, we've had this narrative for nearly 40 years. And nationally, it's been very prevalent, particularly in the past 5 years during the previous administration. The narrative is undocumented are criminals, they're illegals, they're drug dealers, they're rapists, they're narcos, and they're going to come and take your job and then take all the welfare. That you hear that over and over and over and over again for the past 5 years. And of course, that's wrapped in around the issue of public charge, that if you use any public service, you will never ever legalize your status, blah, 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 blah. And we had that here in California 20 years ago with Prop 187. So this horribly confuses the issue, because this particular pandemic has been so politicized. The very act of wearing a mask, the very act of social distancing, the very act of getting a vaccination are political statements of what you believe this country to be about. You know what? We didn't have this during Ebola. You didn't have people saying, take off your hazmat suit, expose yourself to Ebola. No, that was not there. But this particular one was highly politicized in a way, because given all of the anti-immigrant, and I know it's not about immigrants, and I know it's not about papers. I'm an 8th generation American of Mexican origin. Hell, my family's lived in this country before this country even was here. And I know they mean all of us. All of us. I know that. So this confuses a lot of folks. And we saw this with Prop 187, so that when people are told, if you use any public service, we'll find you and deport you, or you'll never be able to get a green card. Well, then, should I risk all of that and get a test? Do I risk all of that and get a shot? So yes, and I think it was purposeful confusion. So we have folks, plus you have the mixed status families, which most of these are. Interestingly enough, in this state, nearly 100% of farm workers are Latinos. Nearly 100% of farm workers are immigrants. And depending upon the crop and the location, anywhere from 50 to 80% of those farm workers are undocumented. Now, I think all agree that eating food is pretty essential and pretty important. And yet we will not protect, we will not support the population that makes this possible. I'm thinking, well, how smart is that? Hello. So we had that ironic situation during the early months. Remember when we were actually shut down and actually the freeways were free? Actually, there was no cars on the freeway. So you actually had to have permission to be out on a car on a road. So many farm workers had a permit. They were essential workers, and yet they're being stopped by the migrant, picked up and read this and deported. So wait a minute, are they essential or are they not? Do we really like to eat, or do we prefer to starve? I mean, what's going on in this state? For me, that was the most ironic of situations. Yes, you're so important. Come to work, expose yourself. Oh, here, migra, take them. Hello. This is not very rational.
No, it's not. So it sounds as if, Dr. Hayes-Bautista, that this is an ongoing challenge, and that there is not an easy answer or solution to advising all of our undocumented families on how to access testing or vaccinations without fear of consequence.
There is one way to do it. Go to the community clinics, because in the community clinics, your immigration status is not even asked. It's not a factor, period. Your ability to pay is not a factor. That's why we set them up 50 years ago. And they're still here, and they've multiplied. There are over 1,300 in the state.
And so when you say community clinics, we can be specific. We're talking about clinics like Altamed, St. John's Wellness, UMA, a lot of the clinics that are in our communities of East Los Angeles, South Los Angeles, Compton.
Yes, all of those. They have an association, the California Primary Care Association. If you want, look them up there. There are 1,300 in the state right now, and they were purposely set up in shortage areas to serve shortage areas, rural areas, urban areas, you name it.
Excellent. And I know that on our Community Health Council's website, which I believe has been shared, as well as the Best Start Community's website, we are constantly sharing information about vaccination clinics and locations. And I would agree, Dr. Hayes-Bautista, that if folks stay close to the organizations you trust and to community organizations that you trust, and use those to access testing and vaccinations, because we are all working collectively to keep all of our children, all of our grandparents, all of our parents, all of our neighbors safe. And so with that, we're just a couple minutes over time, but I think this has been a fantastic education. I have certainly learned a lot. We deeply, deeply appreciate you, Dr. Hayes-Bautista, and all of the work.
Appreciate the work you're doing. Thank you.
Just, thank you for continuing to tell the truth. That's what we need, to tell the truth about the wrongs that are continually being done to our Latinx families, and how the myth and misplacement of blame around this pandemic is being, hung on our families, when they are the ones who are risking their lives and losing their families, as you have said, Dr. Hayes-Bautista, to keep us eating, to keep us, moving, so that we can get what we need in order to apparently keep the economy going, which I, for one, am more concerned about keeping our families going than I am about our economy. So my shameless plug for, I agree with Dr. Hayes-Bautista. If you can vote, please vote, because we need universal health care. We need universal basic income, and we need some universal compassion. How about that?
What a concept. Thank you so much. Thank you so much.
Universal compassion. All right. Well, thank you so much. Thank you, everyone who joined us today. We appreciate you. Please do join us again soon. If we didn't get to all your questions, I do apologize, but we're going to do our best to make sure we're posting as much information as possible on site. This convening will also be uploaded to our YouTube, so you'll be able to access Dr. Hayes-Bautista's presentation via that medium as soon as we get it out. So again, thank you all. Please take care, be safe, and be compassionate to each other.
Bye now. Thank you, Michelle. Thank you.